In this presentation, we will be talking about chronic diseases and present a plan to manage the high medical costs. Chronic diseases are challenging to treat because they require that patients take medications for the rest of their lives. If the cost is too high, the patient can potentially go on living untreated for their condition. Many patients cannot afford the high costs and become non-adherent to their drug therapy. Cost-related non-adherence is a significant problem for patients facing high medication costs, which can result in patients taking less than their prescribed medications. This can worsen the patient's chronic disease and can result in increased emergency room visits and hospital stays.
One of the main reasons that patients tend to have substantial health expenses is due to the discrepancies between brand name and generic drugs. There are still many misconceptions about generic drugs, despite the evidence suggesting that they are just as effective as their brand name counterparts. Generic drugs are also more cost-friendly, making it easier for the patient to adhere to the regimen. Many healthcare providers still prescribe brand name drugs when cheaper and effective generic versions are available. Brand name drugs are often prescribed due to patient requests from what they see on advertisement. Many patients believe that because the brand name drug is advertised more frequently, it is also more effective. Not only are patients uneducated about generic drugs, but also many physicians have negative perceptions and hesitate to prescribe them to their patients. Whether it is the patient's request or prescriber bias, it is clear that overprescribing expensive brand name drugs can result in patients becoming non-adherent to their medication. Go.
If pharmacists are integrated into chronic care teams, they can play a huge role in assisting the prescriber and patient in choosing the best and most cost-effective medication. However, pharmacists encounter many barriers, such as the lack of clarity in their role and the expectations from healthcare professionals. Along with healthcare providers, many patients do not understand the importance of a pharmacist in a primary or secondary care setting. Even when pharmacists are hired onto the healthcare team, they are not utilized to their full capacity. Due to the lack of pharmacists in ambulatory care settings, many patients with chronic conditions do not have access to a medication expert who could tremendously cut down their healthcare costs.
To improve upon patient access to a pharmacist, more disease management pharmacists should be integrated into chronic disease clinics to help recommend medications and more cost-effective treatment plans. The role of a pharmacist in disease management focuses on saving costs and prescribing the correct medications. Implementing pharmacists into diabetes clinics will ensure that patients are being prescribed the correct evidence-based medication for the first time. Having a medication expert, a part of the healthcare team, will also help limit prescribing errors and adverse drug events.
Integrating pharmacists into clinics with a focus on disease management is a better option to approach chronic diseases for numerous reasons. Pharmacists who are working with an interprofessional healthcare team are involved in the medication reconciliation and prescribing process. By being a part of the team, pharmacists can attack the patient's issues directly and prevent unnecessary prescribing of brand name medications. Pharmacists who can work with patients and prescribe in real time can understand the patient's history and recommend step therapy options when it is appropriate. The pharmacist can reduce delays for the patient to receive their medication, avoid prior authorizations, and handle those issues more effectively than prescribers. The time spent on disease management, especially with a chronic condition, can be used on counseling the patient on wellness plans and options for long-term management. This type of planning will require time and discussion with the patient that prescribers often do not have the time for. This is where the pharmacist can come in and discuss these plans with the patient instead. If a pharmacist can spend more time with patients on their disease, the adherence to their medications will likely improve. Pharmacist disease management is the best option as it can reduce unnecessary appointments, free up physicians' times, and save money for the patients and clinics.
Some of the barriers that may arise when trying to integrate pharmacists include financial incentives or reimbursements and teamwork within the interprofessional team. Currently, pharmacists are not recognized as Medicare Part B healthcare providers. This means that healthcare institutions cannot bill for services that pharmacists provide in ambulatory settings. Because there is minimal reimbursement offered, it can serve as a substantial barrier for pharmacists from getting hired and potential salaries. For insurance reimbursements, there is a discrepancy in the disease management that pharmacists provide and what insurance considers as provider services. Lack of funding requires extra work for pharmacists to establish their value to the institution based on metrics such as disease outcomes, provider time savings, prescription errors saved, and more. Teamwork within an interprofessional healthcare team is challenging for a pharmacist as a new team member because the workflow within that team has to be restructured. This requires trust and effective communication amongst all members of the team. Pharmacists must overcome the teamwork barrier by showing their value in the team, such as identifying and improving the weaknesses of effective care. In doing so, the newly structured interprofessional healthcare team can improve chronic conditions in patients by lowering their treatment costs, potential hospital readmissions, and time inefficiencies.